just got to jump out again because I'm in.
Welcome everybody to our Clinical Pilates course taster this evening. We're super excited to have you all here tonight, and hopefully by the end of tonight's session you will have a much better understanding of what the benefits of clinical Pilates are for one, but also what the APPI methods are all about and how they can really help you as an allied health professional working with your patients. So my name is Laura. I'm a course expert here at Unite Health. So if you have booked a time to chat previously with us, you may have spoken with me on the phone, or if you do in the future, it's most likely you'll chat with me as well. So let me know that you were here. I'd love to introduce Eva, who is our physiotherapist taking you through tonight's session. Eva is an incredible physio and one of our master educators here at Unite Health. So if you are based in Melbourne and decide to come along for some training with us, it's very likely you'll have Eva on the course with you. So I'm sure you'll be able to get an insight into how Eva is as a physio and all the amazing knowledge that she has to share with you as well. So I'll pass it to you, Eva, to introduce yourself a bit further, because I know you've got so much to talk about.
Hi, everybody. Yes, and thank you for that wonderful introduction, Laura. And for those that are Melbourne based, you would likely be seeing me on a course at some point. So a little bit about me. I've been qualified as a physio for over 20 years. Wow, it's been a journey. I've certainly traveled around with the physio world. Obviously you can tell by my accent I'm originally from the other side of the world, and in my traveling amongst doing physio, I also was an underwater videographer, which is my fun fact of the evening, and I did a little bit like Joseph did. So for those of you that might be au fait with Joseph Pilates, his surname is certainly out there, and obviously it's the basis for my career, but Joseph basically observed animals, and that's how he's come to sort of work out these exercises and these movements, and I got to do that with the underwater world. So that led me to the start of my Pilates observation journey, and moving to Australia, I've since qualified in a number of Pilates courses, namely APPI, and went down a few rabbit holes of learning, and was lucky enough to meet Sarah, who's the owner of Unite Health, over 5 years ago now, and was renting some space there, and she sort of offered me the option of coming to teach, and I'd already sort of done a bit of learning and was getting the glazed over look from my clients when I got all excited about all the extra movement things I'd learned about, and so I thought it was a perfect timing. So I've been teaching with APPI ever since. I haven't looked back, but I have looked at backs. I've looked down, I've looked up, I've looked at bodies. I've got to work with some amazing clinical presenters at the start, but then also the students, and I learn something new every course, and I hope I help others learn too. So I'm really excited to be here to give you a little taster of what it is to do an APPI Pilates course, and I'm excited to be here. So thank you for inviting me, Laura.
Yeah, super exciting. So for everyone that may have just jumped on, tonight's 1 hour session is going to introduce you to what APPI is all about. Eva's going to run you through some key elements about APPI's training and some particular exercises that we teach on the course that can be really beneficial for your clients. Please make sure to stay on till the end as well. We will do a little live Q&A where myself can answer all your questions about the courses, and Eva will be here to answer any further questions about the more education pieces. So let us know at the end if there is anything you would like to know more about. And also we do have a special little offer for those that have attended tonight as well, which I'll share with you at the very end of tonight's session also. So let's jump into it, everybody. If we just go on to our first slide of the evening. So a bit of background about APPI for those that may not have heard of us before or wondering what APPI actually stands for. It's the Australian Physiotherapy and Pilates Institute. So it's an education provider that has been around for over 20 years. They're very well known in the industry, particularly in the clinical space, where the two founders were actually from Melbourne originally, who moved to the UK to start studying the research-based Pilates in movement, and created the APPI stream of education pretty much. So we now teach this in over 24 other countries around the world. So if you do choose to train with us, you get an internationally recognized certification, and you join over 50,000 instructors worldwide, which is massive as well. And obviously the training that we deliver has all been written by physiotherapists, and we have wonderful educators like Eva on the courses that deliver this education for you. In our clinical training, the anatomy and physiology is all pre-assumed knowledge. So as long as you are a working allied health professional or have completed your degree or even studying your degree in allied health, you are eligible for this training as well. And one of the best parts about the APPI methods is it's something that you can be immediately implementing into your clinical practice, which we'll talk a little bit more about at the end and how that works in terms of the certification levels. But hopefully that gives you a nice introduction about where the APPI come from and what it's all about. But obviously tonight Eva's going to take you through so many great elements of the training just to give you a taste of what it could be like to come on the course with us. So I'll pass it over to you, Eva, for this evening, and I will jump back on at the end. But have a great session and I'll see you all soon.
Great, thanks so much, Laura. All right, so we'll start just touching on the benefits of clinical Pilates. And I think, look, for me, I qualified as a physiotherapist, and I went through the hospital stream back in the UK. It was more, expected we work through that, and I did the APPI course pretty much straight out of uni and utilized it in that space. And it was only really when I moved to Australia and decided that I wanted to work solely in Pilates that my real love for movement and physio came into effect, because it was this idea of being able to look at the body from I call it like the fisheye lens. Of course I would, having been an underwater diver, but having this big lens to look at the body as a whole. We learn things in these sort of small parts, and then to be able to step back and look at everything and start to help clients work on their whole body. Excuse me, I've just got children making noise in the background. Working on their whole body, and just knowing that really, it's never just a one body issue. Everything's connected, and being able to work with a client as a whole was just such a big aha moment for me, really. And to have that extensive repertoire of exercises, there really is an exercise for everybody, for every need, for every movement, for every area, and it's lovely that we can incorporate those all together. And obviously, with the movement practice and using movement as medicine, and for me, certainly in my work now, is I have practitioners that I refer for the hands-on work, and I will assess as a physio, and obviously hands-on for the assessment things, but I would title myself a movement physio, so I treat with movement, and it's clinically reasoned movement. So I'm providing a movement direction, I'm providing an experience, I'm moving the joints in certain ways, I'm working different muscle groups as a treatment, and ultimately the Pilates are treatment tools. Pilates exercise are treatment tools to help my clients achieve their goals. And for me personally, it was really the better outcomes came about when I started moving my clients more, and in a space where they'd come to me for an hour in a Pilates class and could just really get them moving, move their whole body, get them experiencing movement, and just got some really great outcomes from that. And of course, you get to move yourself. So the best that I was my most fittest when I worked full-time in the Pilates movement space, because you'd be demonstrating exercise, you'd be moving around, and you get really strong by virtue of a demonstration, and also learning and practicing. And of course, I love Pilates, so I do it for myself. And so really you get to have the healthy movement practices for your work, life and play. And it is really important to know, and you are the most important person in the room when it comes to caring for your clients, and you have to be able to care for yourself first to be able to help your clients. And of course that comes into play in terms of our manual handling, how we're moving ourselves, and Pilates brings that, shines a light in our brain really of our body, and helps us to move better. And of course, we're allowing ourselves to provide our clients with a safe and effective way to exercise. So not just for rehab, we're giving them the tools of awareness. And look, Joseph was big on, you attending every day when he was running his classes, so 7 days a week. And it's not exactly how I'd like to spend 7 days, maybe 5. So look, what we try and do when we talk about working with our clients, we want to give them home exercises and awareness and cues to help them go about their day and have that same experience of good alignment and effective functional movement. Lots of options of movements in there. And with that sense of body awareness that can be highly valuable in other forms of exercise beyond the Pilates studio. So for me, Pilates was the foundation, and from there, CrossFit, cycling, running, being pregnant, which is a sport unto itself, having children. So, you know, it's so much that can come from that. And that sense of awareness and the foundation of Pilates has also led me to look into more movement practices. My special interest at the moment, and has been for some time now, is looking at the feet and how I can looking at them as a gateway to understanding human movement, and also going into the breath. And I've also done some women's health training. So that lovely foundation from which I've used as a stepping board forward in my career and in understanding. And you know, I think there's a question there about are you curious about movement? Well, I think curiosity is what has driven me this far, and I hope that I continue to be curiouser and curiouser, and I hope for the same for you guys. So heaps of benefits of clinical Pilates. Movement is medicine, and it's that gift of know thyself, heal thyself. You know, this ability to give autonomy to our clients. They can move themselves. We're going to help support them. It's not this sort of need where they come to us assuming we're going to fix them. We're the conduit to help them to heal and improve and to feel better. And certainly that hands-on piece is there, the movement piece is there, and then that movement piece is then when they can take on that and carry that by themselves, which is great. Excellent. Those strange noises are my dog. If she does interrupt any further, she might go outside, but she just likes the fact that I'm here with company online, which is very strange. Okay, so let's go here, not to there, that's good. All right, so what I thought we might do, for those of you, and I haven't got, I'm assuming we've got some students that have come through, we've got some health professionals that are working perhaps more in a hands-on space, those that are newly qualified that are looking to work in the space. And for most of the clinics that I am aware of, you know, there's an expectation to be doing some hands-on and some Pilates rehab in there. So this will sort of serve today as kind of an intro. If you've already done some Pilates, then this can be a nice refresher for you. And if it's your first time, we've kept it really simple so that you can keep up. So true to form, with APPI, we always try and keep it functional. And so Pilates is what we use as a way of helping our clients be successful in all the things they wish to do. And functional for me is always on feet. Lying down for exercising is great in terms of isolating. I'm just going to set this screen up a little bit better. But then when we can come to back we go. When we can find our clients, help them find their standing form. Will my head still be here? Oh, hello head. Wonderful. Okay, so come to standing. I know it's 5:15 on the afternoon. You're probably feeling a bit tired, and I can't see you, so you could still be sitting down if you wish, but I just invite you, come to standing, take your shoes off, take your socks off, just have a little bit of a shake for a moment. Let's just connect in. And of course, as I mentioned before, feet are my thing. And, you know, obviously I talk about the whole body, but it's lovely just to connect and ground down through your feet. Should add it to the 5 key elements to make it the 6, but just connecting down, feeling your feet into the ground, you know, like that moment of just grounding and connectedness. 3 points of contact make up the tripod of the foot, the knuckle of the big toe, the knuckle of the little toe, and the heel. So find those 3 points on each foot and ground down. Okay, grounding down, and then we're going to send energy up. And we're going to find the pelvis. The pelvis, or as we fondly refer to it in Pilates, the bowl, because it's often referred to as a bowl of water when we try and help clients move it in isolation. So find your bowl of water, and it can be a golden bowl if you wish, and you could have something other than water there if you wish, some sparkling water maybe. And let's start by moving the pelvis. And in moving the pelvis will actually help it find some good position. So I'm going to come side on so you can see me here. But what I'm going to effectively ask you to do is tip some water out the back of your pelvis. And that's called the posterior tilt. And then we're going to tip some water out the front of the pelvis, the anterior tilt. And just notice how that feels. So what we really want to be doing when we start our clients off with their exercises is getting them into their bodies. We're just too much in our heads in the day, and just connecting, noticing, bringing awareness and getting things moving. And we want this to be a pain-free and positive experience. So asking clients, so how does that feel? And only moving within what's comfortable. So if something feels uncomfy, it's a message from the body. We don't necessarily need to move there again to hear that message twice. So a couple of movements there, and then just find where you feel like you're in the mid position of that movement. And that mid position is very unique to you, but ultimately it will be somewhere between all the way anteriorly tilted and all the way posteriorly tilted. And in that position, we've sort of got a sense of a centering experience. And then what we can do, and perhaps you've got your chair in front of you, you can actually, standing here, you can press down on the chair with your arms, and you might feel a little bit of tension start to build through that sort of lower abdominal region. And so the pressing down action, we know that when we use arms in front of us, we actually have to engage through the local core area, the local muscle system here, just to stop ourselves from coming over. So we know that this is a lovely way just to give that experience of what that activation might be. And obviously in Mat Work 1, we talk more about ways that we might consciously engage this area, and also ways that we might think about perhaps just positioning the body in such a way that it has no option but to activate those muscles, for those that may struggle with the conscious cueing approach. So different ways to find that centering. But for me, with clients, when I'm first introducing, I might be just simply doing a press down and asking them to experience what that might feel like for them, bringing awareness to that area. Really nice. Okay, well, we found that pelvis position. We've kind of done a little bit of centering into this area. Lots can be said about this, and obviously that's for Mat Work 1. And then from there, we're going to find that rib position. So our ribs sitting around, coming from our thoracic spine, we can consider the same movements happen at the rib as at the pelvis. And just to try and help that rib position, let's use movement here. So if you can, just pop your hand onto your breastbone, sternum there, and let the pressure of your sternum, let yourself slump down. A physio said the word slump. It's okay. The world won't end. We'll just let yourself slump, and that movement's coming down, that little bit of a anterior tilt of the rib, and then we're going to let that breastbone lift up. And so just a little bit of movement here and back. So if you like thoracic extension and flexion, if we're looking at it from this angle, just moving a little bit there, and just find again where you feel like you're in that mid position. And then between these two places, what we can actually do is open our imaginary Pilates bag, pull out a couple of springs, and then just attach them between the rib and your pelvis. And then from here, you're going to just have a sense of this area just remaining equidistant apart. So it's not going to change necessarily. And we expect movement to occur between the rib and the pelvis when we move, absolutely. But when we're looking at trying to dissociate the arm and the leg from movement, we want to challenge this area to remain in that place. And by virtue of staying in that place, we're going to be working the muscles there. So often we refer to letting the ribs soften and connecting this area. And springs are lovely because springs aren't necessarily fixed. There's a little bit of movement there, and we know that the body is always moving. So we just want to encourage that lightness, accessibility to movement, but this idea of, can this area work to maintain a position that allows energy to be generated into our limbs? Really nice. Okay, so we'll travel up from the ribs now, and we're going to find our collarbones. So clavicles through here. Now, you might be reading the slide there and then looking at me thinking, does she know where her shoulder blade is? Well, yes, I do, and it is behind us. But one of the things that I find is a lovely way of positioning the shoulder blade is to come to the front here at the clavicles or the collarbones. And what I like to refer to, as I'm doing now, is the smiling collarbone. So if I said to you, squeeze your shoulder blades together, we'd probably see a really strong retraction there. And actually, we want a subtlety and a lightness around the scapular and the glenohumeral joint, purely because this is a very biomechanical wow movement. And we really want to be considering a lightness and some of the cueing in terms of those 5 key elements to help people find that lovely mid place where they can kind of have a good sense of being aligned. So we're going to have that sense of a smiling collarbone. So see how that feels for you. So smiling collarbones. And for me, I already feel like my shoulder blades are in a wonderful position from doing that. And you'll notice that you'll start to get that lengthening through the front, and the shoulder blades should sit nice and comfortably. Now, ultimately, we are designed to be asymmetrical, and symmetry does lend itself to helping sharing the load better. I look at symmetry as the holy grail of movement, and something that we will be striving for forever. And it's all the fun of trying to take ourselves from our wonderfully wonky bodies into maybe a less wonderfully wonky, or a differently wonderfully wonky, but wonderful nonetheless. And thinking about how we are aligning ourselves and bringing awareness to where we are will help us do that as well. All right, last but not least, let's go to the head. So thinking about the head and neck position, really where the head goes, the neck follows. So I'm just going to cue you guys to imagine that your head is a helium balloon and let that helium balloon float up. So lengthening through the head. Now, what some of you might have done is you might have lifted the head where all of our conscious thought happens at that frontal lobe, and you'll have noticed that you've actually just lifted your nose and created that crease through your upper cervical. So upper cervical extension there, which tends to be the position we find ourselves in sitting in front of the screen. So take your hands and run them up the back of your head and just let the back of your neck come along. And it's almost like if you had a ponytail at the back there, you're going to lift up through there. And that's that lengthening through the back of the head. Now, when we go through 5 key elements with our clients to start, more often than not, we're doing that lying down. We take gravity out of the conversation, but just to get ourselves up and moving a little bit, it can be a lovely way of bringing awareness into those areas for us in standing. And as a way of kind of warming someone up into a class, I often start standing, go through the 5 key elements or just 1 or 2 of them for the focus of the class, and then start to move and get things happening from there. So that's the 5 key elements. I hope lots of questions are coming up from that, but we'll save those to the end if we can, and we'll just continue moving through from here. Good. I hope everyone's keeping up. Good stuff. All right. So obviously the clinical side of things is around the course is around learning movements and exercises. And what I thought I'd do today is just cover off 1 or 2 in the mat workspace, and then we'll connect those through to the equipment exercises as well. So you can see how the course is kind of interwoven and how you can utilize your mat work with the equipment based exercises. Now, mat work is actually harder in essence, just by virtue of not having any feedback really from the machinery, which is why the equipment has done so well in that sort of rehab and fitness world, is because it's just information about where our body is that provides a challenge as well as support. But the mat work exercises are the most functional in terms of not requiring too much input. So it's harder work in that regard. So what I thought we might do is we might do the clam. So actually, I don't know if I can get a show of hands. Can I, let's just see here. If I can get a show of hands. There you go. Let's just see. Maybe not on that one. That's okay. Oh yes, someone's raised their hand. So just hold on. Thank you. So you can raise your hands if you've done the clam before. So I just asked you to raise hands for no reasons, but because for the most part, the clam is an exercise that is taught when you're a student in the allied health space, and it's very commonly given out. Most of you will have done a Pilates class in the past, I imagine, sort of given that you're here. And the clam is one that gets a little bit of bad press, but also because sometimes the way that it might be taught or understood it doesn't always have the desired effect. So I'm going to just go through the clam. So again, you can just watch, absorb what you need to absorb. And I have a son banging his hammer out there. Okay, no, that's okay. He stopped. I just waved madly at him. It's okay. He's 7, so we're going to allow him the freedom of having some fun in the garden. Okay, wonderful. So we're going to come to lying on our side, and what we're going to do here is just, you want to imagine that you're up against a wall here. So lying on our side, we're going to take that same 5 key elements, because we've changed position now, and we're going to have the back of our head long, like we're up against the wall. We're going to have our rib and our pelvis position in that equidistant. So we're just going to check we're not lifting our chest too high in front. We're going to have a little bit of space to our midline, which is putting our pelvis in that good position. And our feet, you can lift them up, and they're going to be in line with our pelvis. Okay, so you can see on the screen we've got the level 1 and level 2, and so we're just going to start with the level 1, and all I'm going to ask you to do is you can pop your hands on top of your pelvis here, and you can sort of feel between the pelvis and the hip joint, so you can just go there, and then you can just simply lift up and down. Now, when you do that, just notice did your hand move, because here often what we might find is that the pelvis will sort of rock, and the goal of this is the pelvis to remain stacked and the movement to come at the hip joint only, which is external rotation. External rotation, we're going to get our lateral glutes
firing up. Also our external rotators of our hip, which are very important muscles in terms of stability. Also in terms of the rotators of the hip are what the pelvic floor can attach to as well. So we're starting to think around how this core connection is going to come in. So from here, coming up and down. Now, my number one question with this exercise is, where do you feel it? Because if you are feeling it more towards the front, and again, I love asking questions, and I'm going to have to just pose this question out to you and assume that you guys are going to answer, but what muscle is it I'm going to be working here if I am actually feeling it through the front? Yep, TFL. Thank you very much for that person that said that. So now TFL is a wonderful muscle. It does get some bad press. And yes, we do want to give the TFL some love, but today with this exercise, we are trying to work the lateral glutes. So the glute med. So what I'm going to suggest is that if that's happening for you, we're going to do a couple of things. First thing we can do is straighten the leg a little bit and see if that changes it for you. If it hasn't, what you can do is you can move your feet back where you're creating more range at your hip joint, so more extension at your hip. And we know that the TFL doesn't tend to like too much extension. It's much more like a flexed hip. And see if you can still feel it here. Now, if you still can't, what you can do, and what I will get my clients to do when I'm giving them a home exercise, is I actually get them up against the wall, because I want to give them as much information as possible. And sometimes I might lift the heel a little bit so that we've got that nice gap between the knee and the hip. And I'll get them to dig their heel back. So we're getting some of that glute max involved. And then we can try there. And that usually, bingo, get things working through there. So this exercise, this clam is a wonderful exercise to start waking up the lateral chain of the lower limb. Now, doing clams will make you really good at doing clams. Yes, they are a wonderful exercise, and I give them to clients when appropriate. There are some clients, particularly those with any kind of tendinopathy, we want to be cautious about how much range we're putting through there and take it as an individual client by client case. However, another banger, sort of mentally sending him messages not to bang. Yeah, I have my husband there, thank you. He's smiling. This is real life. With the clam, we absolutely we start with that, and with APPI, you know, the goal is we're gonna work in isolation. We're gonna get to that place where we're sort of building up some awareness. You know, you're going from a unconscious incompetent, not in a negative sense, but in terms of what you know, all the way through to a conscious unconsciously competent. So you can just do it. Here you don't even know what you don't know, and here you're doing it. And you don't know it because you've done all the work beforehand. So with the clam, for example, that's going to be sort of at this level. And as we start to get you stronger and working more, we're going to think, okay, what's more functional here? Well, it's got to be standing right. So let's move to that next exercise. Now, hopefully, I'm just going to check this chat. Oh, that's okay. Yep, good. All right, thank you. All right, so we're just going to look at this exercise. So one of the things I've gone through the clam with you to see for this one, and then I'm not going to spend too long on this, but this is in mat work 1. So this one actually it's almost like an extrapolation down from the mat up to standing. We utilize this as a warm up and a cool down, but you can also use this into a strengthening. And I'm just going to do a brief demo of this one. So we go through this in mat work 2. But from here, we can have the turnout position, but I also like modifying some of these exercises, feet facing forward. And actually from here, we can do some single leg work. And ultimately, it's about then taking you into that single leg. We know working in a single leg position is our most functional, and that when we are on one leg, we really have to work that lateral chain to stop our pelvis from dropping down. So really nice to be able to access that area and work on that. So that's the nice exercise that I enjoy teaching when we're in when we're doing mat work 2. All right, so from there, good. Just 1 second.
All right. So then one of the other ones that I really like to just touch on as well is the leg pull in prone prep. Now, one of the things with Pilates, and when you do end up, I'm sure some of you, when you're working with clients, already, they'll come to you and they say, oh, I've been told I need to work on my core and my glutes. It's almost the common mantra. And of course, that's how they've understood it, but just knowing that obviously everything's connected and we want to be considerate of the whole body, and obviously assessing the client and determining what their needs are in conjunction with their own goals and expectations. But this is a lovely exercise to start working through the abdominal region without necessarily putting too much strain through the head and neck. And remember, we are in this sort of head forward posture on a regular basis, so it's a nice way of retraining sort of the back neck muscles, that upper body strength, the upper body posture. We're sat at desks for the most part, and then starting to engage through here. So if you want to have a go at this one, I'm just going to get you setting up in this 4-point kneel position. And remember, when we move into any new position, we go through the 5 key elements. So pressing down through your fingertips, taking the load off the wrist a little. If you need, you can roll your mat up underneath your palm to reduce that range at the wrist. Think about eye gaze where the fingertips are, long through the back of the neck, and you can do a couple of pelvic tilts here to find that nice mid position. Now from here, your pelvis is going to stay still. You're going to tuck your toes. You breathe in to prepare, and as you breathe out, you're just going to hover your knees from here. Good. And then lowering back down. So that should feel like a little bit of energy through this area. And when I'm teaching this to my clients, I'll get them to move forwards and back in almost like a slight rocking position, just to help them really find the position that gets them the best activation through their abdominal region as a way of working through there. So a lovely way to take that, the exercises from the mat, and certainly from lying on the back to lifting the head into a 4-point kneel position. So this is one of my favorite go-to exercises, and coming from a cycling background as well, it's very relevant for the cyclists that I work with in terms of getting that good positioning on the bike. And then I just wanted to show you from here just where we would be taking those exercises and sort of some of the reasoning around the clinical reasoning in terms of working with our clients is ultimately we're hoping to progress them into that functional space and challenge them and create that challenge and variety. And so from here, we can sort of see that we would take that into that leg pull in prone. So be able to challenge that long lever, start to challenge the abdominals, the upper body strength, and then we might be taking this into the press up as well. So from there, so that can be a really nice way to look at utilizing some of the mat work exercises that we've got there. All right, so looking at the mat work levels, we've got mat work level 1, which is that foundation course, teaching the Pilates principles and the beginner repertoire. Now in that we go through the 5 key elements. I do know that I did miss off one of the 5 key elements when I was going through everything. So I'll have someone, you can add to that in the chat if you can think of what that was, but it was definitely around the breathing. So the breathing is that last 5 key element that we come into, and we touch on that in mat work level 1. Breathing is integral to our life and to the exercises. And so just being able to bring awareness to your breathing. It may not be what we cue all the time, because ultimately we want our clients to just breathe. And we layer on the breathing for the exercises with our clients. And again, taking it by case, each individual client will breathe their own way, and just making sure we are supporting them in their journey. And then from there, mat work level 2, so that's focusing on the warm up and cool down repertoire and the group class teaching. So we go through repertoire there and then bringing all of that together. Again, throughout the levels, you're going to be enhancing your teaching skills as well. And then mat work level 3 is offering more advanced repertoire. Within mat work level 1, we also do a small equipment workshop. And in mat work level 3, we look at sort of mobility and tools that we can use to release the body. So that hands-on conversation, again, we can get clients moving, with a spiky ball or with a ball and helping to release out different areas, again, creating that autonomy for them. All right. So I don't sadly have a studio behind me here today, but what I'm going to do is just touch on the APPI equipment exercises and talk to the way that I would take those mat work exercises that we did before and link them into the repertoire. And then we'll talk a little bit about how that all fits together. And ultimately with APPI, the reason that I enjoy teaching it and we get such positive feedback from the students is the fact that it is very repertoire heavy. So you just have loads of different exercises that you can pull from your Pilates bag to help work with each different client that you see. Because remember, there's no single client that's going to be the same. So the more variety you can have, the better. All right. So now when we were thinking about the clam, obviously we're looking at that external rotation, internal rotation. Now, my favorite exercise on the reformer for getting the glute working is the side lie, side plies. So this exercise is really nice because we're actually allowing your pelvis to be on its side. We're not lying on your back, so your bottom is sort of free, the glutes are free to do their thing. And actually, by virtue of having the foot slightly forward on the bar here and the bending of the knee, we actually allow that range of the glutes. So we know that a muscle will work best when it's at its most lengthened because it's got more range to move through. So moving from a flexed position into extension really helps access all of that glute. Certainly working on extension exercises will help the hip extension, which is important. But if we want to get your glutes working, it's starting from that flexed hip position and then coming around. So this is just gold. And for clients that are lying on their side, I'm also in a position to move their pelvis into anterior tilt or posterior tilt to find what makes them feel like they can access that glute activation better. And often here they may sort of say, I can feel it more in my quad, and that's where you can change that pelvic position a little bit. There's also an option to put a strap around the thigh on the reformer, and we talked through that in equipment 1, but then also equipment 4, we actually have on the caddy, we're going to use the spring from the caddy, which is that little bit more unstable compared to the reformer, as to challenge that stability at the hip. And again, we can start looking at some bicycle movements back and forth, up and down. And I like to give a very gentle distraction through the ankle and the hip and just create a lovely lengthening experience for my client when they're lying on the caddy there. All right, and then if we take the leg pull in prone prep, what we can see here is we can extrapolate that onto the reformer. And so we've got that cat arm dissociation. So a lovely, lovely exercise that I enjoy doing with my clients. So using the arms, but then we can also do the lower limb version. So that dissociation, and we work those abdominals, lovely head and neck position. So we're working that posterior aspect of the neck. We're not getting all those SEMs jumping in from there. And then I might progress that through into a cat stretch. Again, looking at that spinal articulation. And when we look at the way the course is run, we're looking at that this idea of kind of the torso is still and allowing the upper limb and lower limb to move, and then we come into spinal articulation, moving on to advance. So this cat stretch is definitely one of my favorites. And if you think of that like eccentric loading through the erector spinae and also that targeting through the abdominals, it's gold. And I just it looks quite a fancy exercise, and my clients once you've cued them and worked them through, it's a great exercise for the appropriate ones to do, and they feel like I've achieved. They're like, look at me, I can do a cat stretch. So still one of my favorite exercises myself as well. All right, so in the APPI equipment course, we look at, obviously we're going to be covering off not just the reformer, the Cadillac, the split pedal chair, and the barrel, the arc barrel. And they're great tools to have. Most studios will have these for, which is obviously why we've utilized that, but just generally just a wonderful mix of equipment and exercises and covering off lots from there. So, you know, I think the reformer's obviously been in the limelight for a while, but that you can't move past the caddy. Split pedal chair is really functional as well. And I just love some of the moves on the arc barrel. So some great equipment that we can work through and have fun with. And then in the APPI equipment levels, we've obviously got level 1 looking at the lumbopelvic stability, equipment level 2 looking at upper limb and scapulothoracic stability, equipment 3 is looking at spinal articulation and stretching, and then equipment 4 is that high level function full body integration. So they're broken up in such a way that kind of allows you to come in at whichever order you need and covering off those different areas to bring it all together at the end. So that's the equipment levels. I might just come through here Okay, maybe we'll come back. So let me just see. We actually move through that. All right, good stuff. So why don't we come back and we can have a little go through. For those of you that want, because we've touched on those now, we got through that quicker than expected. Let's have a go of the leg pull-in prone. So for those of you that want to have a go at this one now, we will, let's just jump in here. Okay, so now we actually start in this position, and look, with the APPI structure and approach and the methodology is ultimately we see the benefit of variety. We see the importance of challenge and progression. But for me and the other presenters, educators, you know, it's really important that you know, we get the basics mastered, and actually the advanced is the basics mastered. So the ability to be able to work your body in such a way that means you're working everything the right way and not asking other areas of the body to help when needed, sets you up so that when you do progress, you're coming from the right foundation. And the reason I say that is I see people attempting to achieve these sort of more high level exercises, and they can do it, but it's to the detriment of their form, and they've almost foregone form to achieve something. And it's lovely to give them the permission to go at their own pace, and actually they end up doing much better because they've really built the foundation. So I encourage you today, if you want to have a go with this with me, great, but let's just go through those touch points just to make sure that you're building up. And also really permission to you guys with your, I mean, if you've got clients at the moment, you're working one-on-one and giving some exercises, just permission to just go slow and get familiar with the movements and feel it in your body. Because often we are too busy pushing ahead and trying to push too hard here. So let's go back to this exercise and just consider the positioning of the hands. Now, I did mention around the wrist, so if your wrists do get sore, you can put something underneath your wrist as well. I prefer to avoid the fist position if I can, but it is an option, as is coming onto forearms. So you're going to send the pressure through your fingertips and just have a go here, just letting your chest drop and rise. So just working on some scap isolations here, find that mid position. And then from here, we can just tuck, we can actually just come to the pelvis, and we can look and work on a couple of anterior posterior tilts. So some, we call them kittens, those of you that have done cat-cow. So just do a little kitten here, and you can bring attention to your sit bones here, which is really just allowing that pelvis to move first without inviting too much movement from the spine. So find a couple of nice movements there and find that mid position. Now we have popped your hands and set yourself up, but I want you to bring your hands slightly forward here, because we are going to end up into that sort of rocky position, and you can move your knees and feet slightly back. Breathing in to prepare. As you breathe out, you're just going to hover up and just hold for a moment. And notice, is this a real challenge for you right now? If it is, this is where you're going to stay. Otherwise, you can lower back down again. And the next time we're going to come up and we're going to go into that full length. So breathing in, breathing out, hover. And then can you straighten away? And then coming back, and then lower down. If, like me, you think you might need to adjust your hands, you can then bring your hands slightly forward. Breathing in, breathing out, hover, come into that lovely full length. Now stay here if you wish. Alternatively, that pelvis stays still. I'm just going to get you to point that toe down and touch, and then come back and point down and touch. So this one is actually just starting to challenge that single leg. And then from here, you can just float that leg up, come back, and float up and come back. Bending back, lowering down, and just come into a child's pose. Stretch through there. So you, for the most part, would have felt that working in through abdominals. Now,
the question I ask my clients is, where do you feel it? It's very important. And if they are starting to feel it in their back, we're going to get a little bit of back working, but ultimately we want to be thinking about more of that abdominal work. And if it starts to build up, we know that fatigue set in. We want to watch for those shoulder blades starting to tire, you know, the muscles or the head position starts to drop, and watching for that ability for that 5 key elements for the torso to remain in that nice alignment here, and slightly lower at the hips, not so clear on this picture. And we're really encouraging that posterior tilt, not to put them into a posterior tilted position, but by virtue of being in a prone position, often we fall more into anterior. So it's just encouraging back into that mid position. That's good. All right. So now we've gone through that one. Let's just finish off with some a standing exercise now, and we'll come back to the previous one. I've been very time efficient here, and I think it would be nice to give you guys a little bit more of a moving experience and a little bit of reasoning as to why I was looking at this exercise. So let's come back to here. So coming up to standing. Now, what I'm going to get you to do is just inside of your feet parallel for this one. So we can have a turnout, and that's an option, and that's one of the versions that we can go through. But I'm just going to do a slight modification to this one. So the inside of the feet are parallel. Those 3 points of contact on each foot. Now, I'm going to start you with just a little mini hip knee squat. Now, I refer to it as the hip knee because I want to encourage your hip to flex and your knee to flex. And I don't want you to go down too far. I really just want to have that experience as if you're sitting in a high stool. And we're just starting to work that area, getting that slight knee bend. Now we're going to come over to the left side and really ground down through those 3 points of contact. So pressing down through there. And then I'm going to get you to take your leg that's not grounded down, and you're going to slide it away from you. So you can see how we're sort of modifying this. And this is actually a skater exercise that's in the equipment series on the reformer. So we get to sort of create our own little reformer exercise here and go out. Now, what I'm going to get you to do is to bring that leg forward now. So we're challenging this single leg. We're going to be working that lateral side. Again, just go into what's comfortable for you. I haven't obviously assessed you, so I'm assuming you guys can just be the masters of your own destiny. And now we're just going to come into a bit of a curtsy and then come up. So effectively with the femur bone and the ilium and the fact that I have this other leg that's moving, I'm just creating that movement all around the top of that ball and socket joint. So it's a lovely way to nurture that joint. Let's come on to the other side. So grounding down, 3 points of contact, come into that position with the same little knee bend, hip bend, and then we're going to slide that leg away. So grounding down and then coming back. You do a couple here. And then you can come forwards and then back, so like your scooter, and then you can come into a curtsy as well. So this is a lovely exercise to start to help someone experiencing that activation through that lateral glute. We're working on single leg, very functional. Whenever we're walking, you are going onto a single leg onto the next, and we're looking at working into all that range of motion through the hip joint. So that was me elaborating onto that one for you. Now Laura's going to join us in just 1 minute. So, look at that for timing. I'm just going to click through to where we are here.
Thank you so much, Eva. That was amazing. So much great information, and hopefully everybody really got to understand how you could take this education and really benefit your clients in an amazing way that you may not be able to do at the moment. So obviously, you know, what was that, a half an hour, 45 minutes of Eva just going quickly through those. You can imagine what it's like for, you know, 2 full days on the course for each level that we provide. So to give you guys an idea of, you know, I know we've touched on a few mat work and equipment exercises, but the actual course itself and how it's structured, in total, the training works out to be about 14 days. So it's really, really substantial. You know, you'll learn literally everything you need to know about clinical Pilates. And that will be your mat work levels 1, 2, and 3, and equipment levels 1, 2, 3, and 4. So each level is worth 2 days of training. Now, the way that APPI actually structure the course is really, really beneficial for busy professionals like yourselves. So it is really flexible. Students have up to 2 years to work through all of those levels. So you can take the course entirely at your own pace in terms of when the dates are available, you can choose whether to book those or maybe wait for a later date to come out at a later time. The only prerequisite for you is to make sure you do that mat work level 1 first. That's going to really set you up with the foundations and fundamentals to then carry through those other clinical levels that we offer, so that you can do them then in any order that you like, giving you that freedom and flexibility to book in for the dates that work for you in the time frame that you want to get the course done in. So lots and lots of dates coming up for the second half of the year. I know we are already running super low on availability, but the next mat work level 1 is actually on the 2nd and 3rd of September. So it's in a few weeks. So definitely get in touch with us if you'd maybe like to think about starting then. But there will also be another start date in November as well. So there's timeframes that you can start this year, and we can move on to that next year also. We do include all of your certification assessments as well. So that's something you'll do right at the very end once you've finished your levels. And in total in the course, as Eva mentioned, it is a lot of repertoire. So you will walk away with over 250 clinical Pilates movements that you can be using on the mat, the reformer, the Cadillac, the split pedal chair, and the arc barrel. So, you know, it's very, very substantial and is definitely going to give you the best chance at supporting your patients through recovery. As I said, that is that flexible training. So you will have 2 years. For everyone that may be interested in booking a time to chat with me, I'm just going to pop in the link there that you can just book directly in. We have some availabilities Thursday and Friday to chat with you. So if you would like to discuss it all a bit further, let me know. We do also have that special offer I mentioned earlier as well. So you're kind of getting 2, yes, please, Eva, thank you. You're getting 2 discounts here, really. Our upfront cost is already reduced by $1,400 down to the $4,995. We do have payment plans available. And as it says there, if that payment plan doesn't suit you, please, again, reach out to us and we'll see what we can work out for you. But you do save the most with the upfront cost there. And then for joining us tonight, we would love to offer you guys an additional $200 off that upfront cost as well. And if you do opt for a payment plan, we can take that $200 off your second payment as well. So there's a chance there to obviously save a lot on the course and get started this year, which we would love to have you on with us. And you can meet myself and Eva in person if you're here in Melbourne. But we do have our courses also running in Adelaide, Sydney, Brisbane, and Perth. So let us know if you're in any of those states that would like to have a look into the courses a bit further. If you're not and you're maybe in more regional areas, still reach out. We do have some online options that we can take you through also. So we'd love to open up to you guys now for any questions that you might have about the course itself, about the education. You know, Eva's here, so definitely, you know, absorb all of her wealth of knowledge that is available to you right now. So if you do have further questions about what Eva went through tonight, we'd love to hear from you. If you have some questions about the course, I'm available as well. So just pop them in the chat and we'll stay on till 6 o'clock to be here to help you guys with any further questions that you may have around the training. Anything else you might like to add, Eva?
There's always lots I'd love to add.
There's always lots
We've only got 5 minutes. Look, I think it's Pilates is a wonderful foundation to set you up with providing great tools to help your clients. And I really believe that when we can move our clients and we give them the power to move themselves, like that's where the magic happens. So it's a really wonderful experience. And it, you know, without wanting to make it all about me, you know, when you actually help someone, they're like, oh, you've done? And it's like, I'll take the credit, but it was actually mostly you because you've moved yourself. And, you know, it's a wonderful feeling when you know, help someone achieve something and you've got them from, you know, just not really being able to do anything to kind of achieving their dreams. So yeah, it's wonderful to get contact.
I mean, I was that person that struggled with those, you know, that chronic pain for a long time. So it was Pilates that got me living a functional day-to-day life, which is why I work in the industry. So I can totally relate to that. But also on the flip side, it is so rewarding to be able to provide that education for people that have no clue or haven't been exposed to it before. And I think that's a really amazing thing to be able to offer in your profession to anyone. And I think for physios as well, a really key factor in all of this is having those hands-off skills for the longevity in your career. Would you say that that's like a really big component of Pilates for allied health professionals?
Yeah, and I get a lot of students coming through are, you know, looking to diversify their service and also kind of have a bit of a break from using their hands, from that physicality of it. I think they also know the benefits of the movement piece. And I think one of the skill sets allied health professionals can bring in from their hands-on experience is that attention to detail, and they can carry that over into that movement practice. And, you know, you're almost treating with your words and having the movement effect that your hands did with the movements. And so it's pretty like amazing how you can see the changes without necessarily having to put your hands on clients, but still tapping into that hands-on experience for your assessment, assessing techniques, and then also just some gentle hands-on feedback to clients is gold with that as well. So, and look, you know, I think, you know, everyone watching today, you know, you're all different and unique. You come from, you know, different backgrounds of training, and you're working in different specialities, and, you know, you're never going to meet the same Pilates instructor twice. And so you get to bring your own personality into how you deliver your care. And, you know, in that Pilates space, you know, it's the energy and helping your clients. And, you know, you can take anything you've learned before and really make Pilates work for you. So I think it's a wonderful resource.
Yeah, absolutely. Totally agree. So we've got a question from Michelle. Do we cover any motivational interviewing for the clients who do not see the benefit of regular movement? That's a very interesting question.
That is a very interesting question. And look, motivational interviewing, if I can say it, is a fantastic tool. So sort of that looking at working with the behavioral components. And in terms of the repertoire and the content within the courses, it's not something that's covered specifically, but we certainly talk to it. And I know Peter O'Sullivan is one of the pioneering physiotherapists that sort of talked to that. So where I first heard actually about motivational interviewing. And so definitely linking those aspects in, and, you know, communication and how we engage with our clients is really important. And with that is also, you know, the words we use and how we talk about movement and that positive experience. So yeah, absolutely. You know, there's a motivational interviewing piece. And I think for those clients that have never moved or don't see the benefit, it's how we engage with them. We actively listen to them. We ask what it is for them. We sort of can find the draws for them and what might be motivating them or not. And so I think in our practice, we are engaging and working in that motivational interviewing space, even though maybe not calling it that specifically. But yeah, absolutely, we've got to be able to engage our clients in it, because yeah, I love it, but that's not to say that everybody's going to, you know, who doesn't know about it. So we've got to be able to share that experience and help them see. And for most of the time, clients come to me, they'll say, so-and-so referred me. I've no idea what it is. I don't even think it's going to work. And I'm like, thanks to that person, but okay, let's give you a go. And often it is, we'll assess them, we'll find something that's giving them discomfort, and then using movement and an experience, I'm going to try and move them and give them a better experience with their body, and hopefully address some of that discomfort that they're feeling. And often it's like, oh, that's made a difference, and then they've got the buy-in. So it's often, I don't believe the words themselves are just going to help my clients. They've got to feel it to know the difference, and I want them to feel that. And that is often the case. They're like, oh, that feels really good, and thank you, Eva. So yes, I hope that answered the question, Michelle. Good question. Yeah,
great question. Thanks so much. Hi Josh, thanks so much for sending through a question. So as a student physio in your final year, you're also working in a private practice. Personal relationship, really admiring clients build for each, attends clients further. Amazing. That's so great to hear. Really, really amazing.
Yeah, it is a great, the group exercise space, really it's that kind of it's almost peer-to-peer learning as well with the clients. They connect with each other, they're on different journeys, but they're in the class at the same time, and so they often connect and engage. And yeah, it's a wonderful, it's a very social environment. It's sort of outside that one-on-one kind of clinical space, like treatment space.
Yeah, I mean, the Pilates industry as a whole, I mean, everyone's so like-minded and positive, and you do really make some amazing connections and can network, within that industry and field. Also, clinical Pilates, you can go out there and teach the general healthy population. You've got more education behind you than regular Pilates instructors. So if you have a real passion for it and want to get more involved in studio settings as well, you've also got that option once you complete this course to really open up some more doors and opportunities for you in the industry, to give you some variety and flexibility in your weeks as well. So that's also an added bonus to doing the courses. It doesn't just stop at clinical Pilates. There's many other opportunities out there for you in the Pilates industry right now, and no signs of it slowing down. So it's an amazing time to get it behind you and have those tools to be using with clients.
And just on that, Laura, you made a really good point there. We do cover off how to teach, whilst it is a clinical focus, and we are taking it in the sense of this is a client in front of us and we're treating them with Pilates and movement, but we do talk to how to run a reformer class. We do talk to how to program for those things, because ultimately, if as a practitioner, maybe you're working in a business or you're starting a business, you're going to have a one-on-one, maybe a clinical 1 in 3, but then also looking at having that reformer option for your clients so that you can keep them all under one roof, but then have that kind of level of care that they need at that time. So we do talk to that as well, and I think it's a really valuable add-on to your business and opportunities to work in. So yeah,
absolutely. Thank you so much for joining us. For those that are still with us and spent the whole hour with us to talk about the courses and learn everything from Eva, we really appreciate your time. As I mentioned, we're available. You can book a time to chat with us or just send us through an email from the website and we'll get back to you in the same day. So let us know how you get on, and we really look forward to hearing from you soon and helping you get this education at your disposal so you can go out there and really assist your patients in the best way possible. So thank you so much for joining us tonight, Eva. You've been absolutely incredible, and we love having you as a part of our team as well. And I'm sure I'll see you in the office soon. But thanks so much,
Laura. Yeah, lovely to chat.
I'll stay on for a few minutes if anyone has any other questions, but thanks so much for spending the last hour with us, and we look forward to hearing from you soon.